الحمد لله والصلاة والسلام على رسول الله. أهلا بحضراتكم في المراجعة بتاعة الموديول بتاع الإيميجينج of the urinary tract. وإحنا بناء على طلبات بعض من زملائكم إن إحنا نراجع بعد كده على الموديولات اللي هي خلصت، فإحنا حطينا طريقة إن شاء الله بحيث إن نراجع إن شاء الله الشيست في وقت قريب جدا بعد امتحان اليورولوجي، وبعد لما يخلص الموديول اللي بعد كده هنراجع الجي اي وهكذا لحد لما نتأكد إن كل شيء ماشي تمام بإذن الله تعالى. ونبتدي إن شاء الله الموضوع، وديت أول حالة في الحالات.
urinary bladder cell carcinoma.
Yes, and
right hydronephrosis.
yes, okay, very good. And this is urinary bladder cancer because of the marked concentric mural thickening of the urinary bladder affecting the orifices of both ureters, which is reflected on the kidneys, as you can see, more evident on the right side. Then, what do you think?
Testicular cyst.
Yes, testicular cyst, and this is are different cases showing the same pathology, that you got an echolucent structure within the testicle, which is most commonly representing a testicular cyst. And the cyst is of variable size. It may be in the range of 2 millimeter up to 2 centimeter. It can be also solitary or multiple.
Posterior urethral obstruction.
Yes, and this is urethral stricture at the which part of the urethra is this one?
Vulva.
No.
No, this is membranous.
Yes.
Membranous
This is the membranous urethra, which passes through the pelvic floor, and there is a stricture in the membranous part of the urethra.
Renal cell carcinoma.
Yes, and this is ultrasound of the kidney. This is the kidney showing a solid mass in the upper bowl of the kidney, and you can see the marked vascularity by Doppler ultrasound and the heterogeneous enhancement by CT. And the most common solid renal mass in adults is the renal cell carcinoma.
Hypoplastic left kidney.
Hypoplastic left kidney and
Renal stone.
renal stone on the right side.
On the left side.
Do you see the left kidney?
بلد احمد دكتور، اكو صوت يعني يوشوش المحاضره في سماعه مفتوحه
يا ريت والله يبقى كويس
يأثر على المحاضره.
تسجيل نفس المحاضره يطلع سليم ان شاء الله. Now, do you see the left kidney? No, the left kidney is not present, and this arrow points to a part of the bowel loops, and the renal fossa is empty, and this arrow points to the absence of the left seminal vesicle. Then this is one of the diagnostic clues if you look to the seminal vesicles, and this will support your finding that the left kidney is not present, and this is agenesis of the kidney with compensatory hypertrophy of the right one. Duplex kidney on which side?
On the right side.
Right
on
side.
the right side. But actually, there are two kidneys here and another third kidney on the left side, and this is one of the rare conditions that you can got three kidneys, and sometimes one of these kidneys is located in the thoracic cavity.
Left distal ureteric stone causing
Yes, and this
hydronephrosis
is
to the
the
left
distal
kidney.
ureteric stone with back pressure changes, and this one is a proximal third ureteric stone with also back pressure changes, and this examination is non-contrast multi-detector CT of the urinary tract.
Xanthogranulomatosis.
Xanthograph, no, bilateral symmetric is difficult.
Medullary sponge kidney.
Medullary calcium.
Yes, and this is medullary sponge kidney nephrocalcinosis, the medullary type, and you see calcium outlining the calyceal system bilaterally. The left kidney is somewhat enlarged, but the condition is almost bilateral and symmetric.
Pelvic right kidney.
Yes,
Ectopic kidney.
لا ectopic right kidney
the
pelvic.
right kidney is pelvic and ectopic. في حاجة تاني؟
And the
Any
left kidney complication.
ما rotated.
more rotated? Yes. Any other
Cross.
pathology?
Complication left kidney.
Duplication of the left kidney with hydronephrosis. Do you see the cause?
Distal ureteric stone.
Yes, and this is a radiopaque stone in the distal part of the ureter. There are three pathologies here: duplex left kidney, crossed ectopic right kidney, and a stone on the left ureter.
The chronic pylon.
Right kidney.
نعم. What
Right side.
The chronic
Chronic pyelonephritis of the right.
Yes, and this is chronic pyelonephritic kidney on the right side. This is an important landmark where you can see the calyx is reaching the cortex of the kidney, and this means that there is total loss of the renal parenchyma covering the calyx, and this is one of the diagnostic clues for chronic pyelonephritic kidney. The pyelonephritic kidney is small in size, but it excretes the contrast material in more or less normal pattern. And this is chronic pyelonephritis. What do you think?
intratesticular varicocele.
Very good.
Epididymoarthritis.
Yes, and this is intratesticular varicocele. You know that we have two types of varicocele, one at the neck of the scrotum, which is extratesticular, and another one inside the testicle. And you can see the color Doppler showing the vascularity, and also you may use the Valsalva maneuver to confirm your diagnosis. Very good.
Renal cell carcinoma cystic type.
Yes, very good. This is cystic renal cell carcinoma.
Renal cell
And
carcinoma.
you got cystic lesion with some mural
Smoke type
stones
4.
and hypervascularity, which are impressive of a malignant neoplasm.
Ectopic left kidney.
Ectopic left kidney.
Yes, this is true, and this is ectopic left kidney many times, and this film is projected in the exam, and I got strange answers for this. I don't know why. This is a straightforward case of an ectopic pelvic left kidney in front of the sacrum.
Urinary bladder mass.
Yes, what do you think?
Urothelial carcinoma. Transitional
Yes,
carcinoma.
the most common by far solid urinary bladder mass is urothelial carcinoma, and you know the staging of the urothelial cancer according to the invasion of the urinary bladder and the adjacent structures that has been mentioned in the lecture. Then what do you think? Consider the age is very important.
Dermoid.
This is bilateral testicular masses.
Seminoma. Microlithiasis.
Consider this the age of the patient.
Lymphoma.
Yes, lymphoma. And you know that seminoma is a tumor of relatively young age, around 30 or 40 years of age. But lymphoma is the tumor of elderly and is the almost seen above the age of 60 years, and in about 50% of the cases the tumor is bilateral, and you got two solid masses in the kidneys. You can see the vascularity, and this indicates that this is a malignant lesion. The possibility of lymphoma is highly considered.
Multicystic.
Multicystic
Nephroma.
Cystic nephroma.
cystic nephroma, very good. And this is multilocular cyst, which is involving the right kidney, which is somewhat rotated, and there are internal septations, and this is good for multilocular nephroma.
Benign prostatic hyperplasia.
Okay,
Prostatic cancer.
both. Okay, hyperplasia and cancer, right or no?
Left peripheral zone lesion.
Yes, and you see that the central zone is enlarged with multiple cystic changes compatible with prostatic hyperplasia. But if you look carefully in the peripheral zone, and you can see this low signal, this very small lesion in the peripheral zone to the left of the midline, and this lesion shows diffusion restriction. It is of bright signal in the diffusion. No, see, this is enhancement in the post-contrast fat suppressed T1 weighted image, and you see in the ADC that the lesion is showing diffusion restriction, and this is compatible with prostatic cancer. And you know that many cases have prostatic hyperplasia, and they can develop prostatic cancer in the peripheral zone.
Retroperitoneal fibrosis.
Very good. Then this is retroperitoneal fibrosis. From the IVB, you can also reach the diagnosis by the medial deviation of the ureters towards the edges of the spine, and sometimes there is encroachment on the urine drainage with some fullness of the pelvic ileal systems. If you have the CT, you see the classic appearance of a soft tissue mass that is encasing the aorta and IVC, and also may entangle both ureters. This is retroperitoneal fibrosis.
Right kidney solid mass renal cell carcinoma.
Very good. And this
with vertebral myths.
Where? Here?
The right image.
This one? This is the level
Yes.
of the disc. And
Disc, okay.
yes, and this is the edge of the vertebra, and this is the level of the disc. But be careful whenever you are doing a tri-physical study for the kidney that you may miss a small lesion because of the differential enhancement between the cortex and the medulla. The best way is to wait for the nephrographic phase or the secretory phase where you can accurately delineating the tumor, and this is a small renal cell carcinoma on the right side.
Angiomyolipoma.
Angiomyolipoma of the right
This
kidney.
is air, not fat, and this is fluid.
Air?
Yeah.
Abscess.
How can you know that this is air, not fat? And you compare the density by a nearby air or the density by a nearby fat. Sometimes it's difficult, but If we have the lung window, for example, then you can easily discriminate. But the kidney is swollen and there is patchy areas of non-enhancement, then you got some air within the renal.
Emphysematous pyelonephritis.
Xanthogranulomatous.
No, xanthogranulomatous, you need the presence of a big stone, and for the emphysematous pyelonephritis, you need too much air. But you know that acute
Abscess.
pyelonephritis may be associated with some gases in the renal capsule, for example, and these areas of patchy non-enhancement due to inflammation.
Spermatocyst.
Epididymal cyst.
Epididymal cyst, very good. And you see this hydrocele as well?
hydrocele.
Yes, very good. Okay.
This is cyst 2.
Botanic type 2.
Bosniak type 2.
Yes.
Hyperechoic
Bosniak
cyst.
type 2 cyst category because of the hyperdensity in the
Hyperdense.
pre-contrast scan, and the post-contrast also you cannot see any septation and you do not see calcium, for example, and this is category 2.
Posterior valve obstruction.
Yes, posterior valve and
Posterior valve obstruction
Bladder
and
diverticuli.
trabeculation of the urinary
bladder
bladder.
outlet obstruction with trabeculation of the bladder wall and multiple diverticuli. This is a classic appearance of the posterior valve with bladder neck obstruction or bladder outlet obstruction.
Right cell carcinoma. Right
Cystic.
Cystic renal cyst.
Cystic renal cyst.
And
and invasion to
IVC
the renal
invasion.
vein.
yes,
Stage 3T.
IVC invasion.
IVC invasion.
yes, and this is renal cell carcinoma invading the renal vein, extending into the IVC. Considering this small focal lesion in the liver, it may be a metastatic deposit and may be also a simple cyst accidental finding. Very good.
Potty kidney.
Potty kidney, yes.
Potty.
TB end stage kidney, which is totally calcified, very small kidney with no function, diagnostic of renal tuberculosis.
Xanthogranulomatous.
Xanthogranulomatous.
On which side?
Port side.
Bilateral.
Yes, and this is an extremely rare condition when you can see that the xanthogranulomatous pyelonephritis is bilateral. And you know that this kidney is not functioning and is a source for recurrent infection and it should be removed. But in cases of bilateral disease, there should be a consider how to which kidney that should that may be kept, and the other more damaged kidney should be removed. But they always said that the xanthogranulomatous pyelonephritis is a unilateral disease, and many as if sometimes you can got a bilateral disease, as you can see in this case.
Is there a left soil abscess in the previous case?
Okay, yes, you are right.
Hydatid.
This is hydatid cyst of the kidney, very good. And you see the multiple daughter cysts within the big cyst, and this is one of the very characteristic appearances of hydatid cyst anywhere in the body.
Vistula.
طب يا دكتور معلش نفرقها ازاي بينها وبين المالتيلوكيولار cystic nephroma؟
Yes, multilocular cystic nephroma is a big lesion that it does not enhance, and the cysts are not on the periphery of the lesion. They are totally occupying
Central.
the whole size of the tumor itself. What do you think?
Cancer neck of bladder.
Bladder neck cancer or prostatic cancer?
This is female.
this is
Maybe
female.
urethral carcinoma.
Yes, very good. This is a female patient, and you see the uterus, and there is no way to mistake this as a prostatic lesion. Then this is a bladder neck carcinoma of the urethral type, of course. Very good.
Renal nephropathy.
Yes, AIDS-related nephropathy. And you see the echogenicity of the renal parenchyma compared to the normal appearance of the renal parenchyma. This, there are grades for nephropathy by ultrasound. And all what is needed is to say that this is nephropathy. If you know the cause, you may say that this is related to the AIDS or whatever other pathologies.
Megacystic megaureter.
Megacystic megaureter.
Grade 5
Vasculitic reflux type 5.
Reflux 5.
Type 5.
Vasculitic reflux stage 5. There is a small point here is how to differentiate between both. You know that the megacystis megaureter they are not so much opacified by the contrast material since the kidneys are not excreting contrast in a normal way, and the contrast material will be much diluted. But if you see a catheter here and you see the density of contrast, you know that this is reflux, not the megacystis megaureter.
Renal sinuses. Sinuses.
Yes, renal sinus cyst, which is different from the parapelvic cyst, since the parapelvic cyst is a cystic lesion that lies beside the renal valves. But this cyst is insinuating itself between the helices through the renal sinus. Then this is renal sinus cyst.
Trauma.
Neurogenic bladder.
Urethral injury.
Urethral rupture.
Urethral injury.
Yes, and you see the fracture, and this is the fracture of the iliac bone, and you see the rupture of the urethra at its attachment to the urinary bladder. And this is what we call type 4 urethral injury, and here are the types. Then you may get this is type 1 urethral injury, and this is type 2. Type 3 is at the level of the urogenital diaphragm, and type 4 involves the posterior urethra as well. Then there are many also other types that can be associated with bladder rupture in the same time.
Doctor, how can I know urogenital diaphragm? How can I recognize
It is
it?
at the level of the membranous urethra. The narrowest part of the urethra is the membranous urethra, and this is the level of the urogenital diaphragm.
Like lymphoma.
Trauma.
Yes.
I think this is trauma.
Yes, trauma.
Shattered
Yes.
Shattered kidney.
Very good. And this is trauma, and it was a horseshoe kidney that has been shattered into pieces with a big perinephric hematoma. Okay.
Renal cell carcinoma.
On which side?
Right side.
What about
And left kidney agenesis. Or maybe metastasis. Yes, nephrectomy.
Yes, and this is the left kidney is removed because of renal cell carcinoma, and these are metastatic deposits to the opposite kidney. Yes.
Prostatic CA.
there is a prostatic mass and
Invasion to the rectum.
no.
Inguinal lymph nodes.
Yes, inguinal and external iliac nodes. This is the follow-up after chemotherapy
After chemotherapy, yes.
regression. Then
Yes.
the possibility of
Invasion to the bladder.
and this actually was a prostatic cancer and a metastatic lymphadenopathy. You can assume this from this film, and you confirm your diagnosis by the response to the chemotherapy.
Emphysem, no.
This is fat.
Xanthogranulomatous.
Okay. And this is a new topic I would like to emphasize, which is known as replacement lipomatosis of the kidney. And the kidney is totally replaced by fat, and there may be a stone, and you don't see any renal parenchyma at all, which is not the case in cases of xanthogranulomatous pyelonephritis. And replacement lipomatosis may complicate xanthogranulomatous pyelonephritis. If it persists for some time, then the renal parenchyma is totally replaced by fat, and the stone will remain. And here you can see that sometimes you got a staghorn calculus with obstruction of the collecting system. Then you got stasis and infection resulting in chronic pyelonephritis, which may progress into xanthogranulomatous pyelonephritis. Then after some time, you got a total replacement of the renal parenchyma by fat, which is known as replacement lipomatosis of the kidney. And there are some of the informations about this topic. Is total replacement by fat with variable degrees of fibrotic changes. It is considered to be a severe form of renal sinus lipomatosis, and sometimes is associated with the staghorn with a long-standing inflammation and calculi. Renal replacement lipomatosis and xanthogranulomatous pyelonephritis may occur simultaneously, starting by xanthogranulomatous to be followed by renal replacement lipomatosis. There are many theories about this condition, but be careful for in the diagnosis. And sometimes you see this is the normal left kidney, but the right kidney is totally replaced by fat, except for these fibrous strands and this very low signal stone. Then this is one of the topics that will be included in the lectures after that, but I wanted to give you some information about. Then what are the differential diagnoses of this condition? Renal liposarcoma, which is made of fat and soft tissue, and does not produce a defect in the renal parenchyma. Angiomyolipoma and lipoma are not associated with renal parenchymal atrophy, and the stone is not one of the criteria. Xanthogranulomatous pyelonephritis, as I have mentioned, is maybe a precursor of renal replacement lipomatosis. Okay.
Vesicorectal fistula.
Vesico, where is the bladder? This is the bladder.
Prostatic.
Okay.
Prostatic
Yes.
abscess.
No,
Prostatic abscess.
this is the uterus.
Oh, the uterus. Oh my God.
And yeah, it is the uterus, and this is the urinary bladder. Then you see at the anterior part of the urinary bladder this very small soft tissue mass.
Urachal,
Yeah.
prominent of urachal sinus.
Yes, and this is a urachal tumor. Sometimes you cannot discriminate between the benign urachal masses like leiomyoma, for example, and urachal carcinoma. But you know that carcinoma has an invasive character, but urachal leiomyoma and other benign masses may look smooth like this. Okay.
Emphysematous cystitis.
Emphysematous cystitis, which is similar to any emphysematous itis anywhere in the body, is usually seen in diabetics and immune compromised patients with the development of air inside the wall of the renal bladder as well as intraluminal.
urinary bladder diverticulum with stone.
Stones in the seminal vesicle.
Very good. Yes, this is stones in the seminal vesicle, and I also presented some of the cases for stones, and one of the cases is big stones in the seminal vesicle. We are not usually seeing this in the clinical practice, but you may see this in the exam, for example, because it is not a common finding.
Xanthogranulomatous.
This is a classic appearance of the xanthogranulomatous pyelonephritis and the stone and the obstructed calyces. There is a remaining renal parenchymal tissue and the stranding of the perinephric fat.
Renal cell carcinoma.
Very good.
Cystic type.
Cystic
renal
carcinoma. There is a big cyst with a solid mural component on the lateral wall and diagnostic of cystic renal cell carcinoma.
Nephroblastoma.
Multilocular cystic, yes.
Not a solid lesion, it is a cystic with the whole lesion is occupied by cysts, and this is the CLO sign, which is one of the signs that help you to know that this is of renal origin. Okay, and this is multilocular nephroma is seen in children less than 5 years and also in adults, and it has many cysts inside surrounded by a thick capsule. Sometimes you got calcium in this lesion, and this is an example by ultrasound, the gross specimen without contrast and with contrast of a multilocular cystic nephroma.
Emphysematous.
Yes, emphysematous
Pyelonephritis.
This is a diabetic patient with fever and hematuria. And then you got air, which is almost totally replacing the whole kidney. Then emphysematous pyelonephritis.
Transitional cell carcinoma of the bladder.
Yes, and this is transitional cell carcinoma of the urinary bladder. Concentric mural thickening, which is more than usual. Sometimes you got concentric mural thickening without irregularity, which is seen in chronic cystitis, but this is too much for cystitis.
Wellness tumor.
Wellness tumor. Yes, and this is a solid mass originating from the right kidney in a pediatric age group, diagnostic of Wellness tumor.
Renal abscess.
Very good. And this is renal abscess. You got enhancement of the wall and the lesional edema in the adjacent renal parenchyma, some stranding and thickening of the Gerotta fascia, diagnostic of an inflammatory lesion. Polycystic
kidney disease and vesical, seminal vesicle.
Yes, and this is globally polycystic disease affecting the kidneys, the liver, and the seminal vesicle. And this is also one of the known criteria for this disease. You got cysts anywhere, but the seminal vesicles are not that common, but you can see these lesions in this particular case.
Prostatic CA.
Prostatic cancer, central zone or peripheral zone?
Peripheral zone.
Central zone.
Central. Central.
Central. This is the
Central zone, left
zone,
side.
and this is the peripheral zone. The peripheral zone is free, and the central zone you got this lesion, which is of low signal in the T2 weighted image, and you got diffusion restriction, brightness in the diffusion weighted image, and darkness in the ADC. And the diagnosis of central zone prostatic cancer is the right answer. And you know that most of the prostatic cancer is located in the peripheral zone, but sometimes you got prostatic cancer in the central zone.
Left kidney edging is
And
retroperitoneal fibrosis.
then this is high for retroperitoneal fibrosis. It's high.
Lymphoma. I think lymphoma.
Lymphoma.
Yes. No.
Of the nodes. What about the kidney?
Maybe it was removed, nephrectomy.
Yes. And this is what I want to say. You see these surgical stitches here, and this kidney is removed. The kidney is exactly similar to the breast. They use it for as a clue in the exams or in the clinical practice. If you see a missing breast and you consider the patient with breast cancer and you interpret the exam from this practical point. Also, if you see missing kidney and you see signs of malignancy, then you know that this kidney is malignant or contains a malignant tumor, and these are metastatic lymph nodes, and the kidney has been removed. Of course, you know that the kidney with lymphoma is not surgically removed, but the kidney with renal cell carcinoma is removed.
vertically.
Yes. You call this Hutch diverticulum or not?
No,
It's high. Then this is a simple diverticulum, or there is some complication.
Transition with the carcinoma, I think, inside.
Carcinoma of the diverticulum.
Yes, this is right. And you see that the diverticulum does not contain fluid, it contains solid mass.
Contain mass, yes.
And this is diagnostic of a carcinoma inside the diverticulum.
Stones in the urinary bladder.
And
seminal
Inflammation of the prostate.
Prostate, yes. Stones in the urinary bladder and the prostate. Very good.
Hypoplastic left kidney.
No, it's not in this section.
Small left kidney.
No, the kidney is good. But you know that the right kidney is much lower sometimes than the left kidney, and most of the left kidney is shown in the sections above this level.
This is right ureteric mass. Right ureter.
Right ureter.
Right ureter.
I don't see the right ureter.
Thrombus in the right
pelvis. Right pelvis.
In the renal pelvis, what do you see
Right
in the renal
pelvis.
pelvis? You see a solid mass, okay? This is a solid mass in the renal pelvis.
Transitional cell carcinoma.
Yes, and you see the differential, of course, include the blood clot and the slough de Babella and so on, but on the top of the differential diagnosis, you should consider the possibility of transitional cell carcinoma.
Absent left kidney. And a large cystic mass for right one.
Yes. What about this cyst? If Bosniak type 1?
No, it's calcified.
No.
Type 2?
Type 3. Type 3.
Type 3?
Yes.
Type 2. Type 2.
Okay, let's look at the cyst. There is a single septum and some flakes of calcium.
Type 2.
type 2F cyst. And whenever you see calcium, and you consider type 2F, because calcium is one of the signs that may suggest the possibility of later on development of malignancy, especially in the left kidney, especially in the kidney. Then if you see a cyst with calcium, you should consider stage Bosniak type 2. F means follow-up.
Prostatic cancer at peripheral zone.
Left or right?
Left.
Left side, yes. And this
Yes.
is the low signal focus and the peripheral zone on the left side contained within the prostatic capsule. This is prostatic cancer. What about this?
Benign prostatic
Yes,
hyperplasia.
yes,
Hyperplasia.
benign prostatic
Yes.
hyperplasia. Very good.
Acute pyelonephritis, left kidney.
Yes, acute pyelonephritis of the left kidney, swollen kidney, striated nephrogram, poor function, stranding of the perinephric fat. All these are the signs of pyelonephritis.
Urinary bladder carcinoma.
And
Back pressure effect.
Multiple urothelial carcinoma
okay,
in the pelvis and the urinary.
urinary bladder cancer with back pressure and
Lymph node enlargement.
metastatic lymphadenopathy. And you see lymph nodes here and there and in the para-aortic area. Very good.
Yes. Yeah.
Multiple myeloma.
Nephrocalcinosis.
Medullary nephrocalcinosis, and you can see it in the nephrogram. Don't consider so many stones in the kidneys, bilateral and symmetric like this. This is not the usual appearance for the renal calculi. What do you think? Normal study?
Normal kidney.
Normal? Are you sure?
Kidney is normal.
Urinary bladder lesion.
And the renal bladder is not well projected here, but
Yes.
you see this very small lesion in the left renal pelvis here. Do you see it?
Yes.
This is very important because actually you got the clue from the history, and the history is not shown here. Whenever the patient had the hematuria, then you look carefully to the collecting system. One of the best ways is to wait for the excretory phase where the collecting system is opacified by contrast material. Then you got filling defect inside.
Blood clot.
It looks fluid.
Left side urethrocoel
Very
from
good.
an
Yes, and this is the appearance of urethrocoel whenever it is not filled with contrast, because the kidney is not excreting contrast material, so it's nephrotic. Then the urethrocoel will appear as a filling defect inside the renal bladder, and it's hardly seen before before contrast, because it contains urine, and the renal bladder contains urine. Only the wall of the urethrocoel you can see. But whenever you got contrast material within the bladder, you will see it as a very smooth filling defect in the renal bladder.
TB.
fatty kidney.
Yes, this is classic appearance of renal tuberculosis, And one of the important criteria for the diagnosis of TB is what is known as sterile biuria. And you got pus in the urine, but whenever you do a culture, you cannot see an organism. This is one of the suggestive criteria.
PUJ obstruction.
Yes, and this is percutaneous nephrostomy for pelviureteric junction obstruction. Yes, and this is kidney abscess extending into the perinephric space and is considered as renal and the perirenal abscess.
Ischemic kidney.
Avulsion.
Avulsion. Yes, and this is
Avulsion.
avulsion of the
Left,
renal vascular pedicle on the left side with dissection of the right renal artery. See the dissecting intimal flap? Both conditions are due to the traumatic insult.
Oncocytoma.
No, oncocytoma is solid. And this is bilateral disease.
Bilateral angiomyolipoma.
Very good. And this is angiomyolipoma because of the fat inside the lesion, and you got some soft tissue material and two big masses on both sides representing bilateral angiomyolipoma.
Emphysematous pyelonephritis.
Emphysematous pyelonephritis bilateral.
Diabetic patient with emphysematous pyelonephritis bilateral. Very good.
Urinary bladder transitional cell carcinoma.
And
Lymphatic pressure. And there is mass in the left kidney also.
There is a mass in the bladder, and this is carcinoma. Then what about the kidney?
There is a
حتى هذه angiomyolipoma. No.
You diagnose angiomyolipoma and renal and the transitional carcinoma? No. But this is the kidney,
Metastasis.
which is obstructed, and there is leakage of urine in the perinephric space as well as contrast material. Yes, and this is because of the obstruction of the ureter by the tumor, and this is what we call perinephric urinome. Urinary bladder cancer with obstructed kidney and leakage of urine and contrast material in the perinephric space.
دكتور البلاك الهايبودنس سراوندد الكدني ده عبارة عن ايه؟
This is the perinephric fat. The perinephric fat. Normal perinephric fat.
Okay.
Dirty fat around the right kidney, and there is a stone in the bladder.
Right, small
stone obstruction in right ureter.
Okay, where is the stone?
The vesico-ureteric junction.
Vesical junction.
This one?
No. Another. Yes.
Okay. Yes, this is good. And this stone is impacted at the vesico-ureteric junction with
perinephric dirty fat
response
pyelonephritis.
And you got no excretion of contrast and the stranding of the perinephric fat. Very good. And this is one of the techniques that you can use in the clinical practice. You put in the patient in the prone position, and you look for the site of the stone. If it is in the ureter, it will not change its position. But if it is a flippulus, it will change its position between the prone and the supine scans.
Renal lymphoma.
Yes, very good. And this is bilateral. this is a child with bilateral solid renal masses, and you see there is also a mass in the tail of the pancreas. This is lymphoma. Criteria helpful for the diagnosis of renal lymphoma is: number one, the patient is known to have lymphoma; number two, the patient is immune compromised; number three, other lesions, especially in the spleen; number four, retroperitoneal bulky lymph nodes. Thank you very much الحقيقة. and I have to say إن أنتوا مجموعة ممتازة جدا وما شاء الله عليكم يعني، وأنا بتمنى ليكم كل توفيق إن شاء الله. وبإذن الله شريف هيحدد لكم الميعاد بتاع المراجعة بتاعة الشيست، وتفضلوا شاطرين زي ما أنتوا كده على طول إن شاء الله.